Chronic obstructive pulmonary disease, or COPD, is a group of progressive lung diseases that obstruct airflow. It is most commonly caused by heavy smoking or long-term exposure to chemical fumes. With good management, most people can still pursue a high quality of life. In a study conducted by ERJ, lower-income people with COPD had reduced access to preventative care and lower quality of life compared to higher-income groups. Clearly, income disparity and its associated respiratory exposures, limited healthcare access, and inadequate education about smoking risks exacerbates chronic lung disease.
To improve the quality of life and mortality of people with COPD, it was clear that it is imperative to provide quick and easily accessible treatment plans, education, and rigorous management to lower income classes that the higher income classes have access to.
So we created Reaspire, an app that aids the management of COPD by providing easy access to pre-established physician advice, allowing patients to track their symptoms, and leading patients through an easy breathing exercises.
App demo for Reaspire. The weekly quiz, which is based around pre-established physician charts used for characterizing the extent of the disease, sorts the users into one of the three zones: green, yellow, or red, based on their responses to 14 questions. Now, as we can see, the user is choosing between yes and no on these certain flags that were predetermined by medical experts. Once their zone is determined, patients are directed to a results page full of lifestyle advice vetted for by medical organizations, or directed to seek medical attention if their situation is dire or they're in the red zone. In short, the quiz ensures that the user's health is evaluated regularly, and necessary changes are made immediately once their symptoms take a turn for the worse.
The Progress tab allows users to track their results on the weekly quiz, providing the user context when deciding if they need to change their lifestyle or seek medical help. The Activities tab contains custom-made graphics, which walk the user through popular breathing exercises. Example is breathing step by step.
Reaspire will perform exceptionally well on the market because it's unique to its competitors in various ways.
Many COPD patients, especially low-income groups, do not have access to physician advice and regular check-ins to keep them rigorously managing their disease. When changes in their health occurs, many are not closely aware of their health and fail to take initiative and adjust their treatment plans to their healthcare provider, or lack access to a healthcare provider entirely. Our app keeps patients motivated to keep track of their symptoms and aware of how to adjust their lifestyles to improve their situations, even if they lack access to the rigorous tracking provided by medical centers. Other apps need a physician to function or cost money to download, so our app provides the best situation and solution for low-income people who lack access to those resources.
Reaspire's target market is adult COPD patients living in California, specifically those who may not be able to afford costly treatment plans and want to mitigate their symptoms by making changes to their day-to-day life. There's a huge market for a COPD treatment app, as there are over 1.6 million people suffering with COPD in California alone. Each of the founders, Ishani Patel, Grace Kuo, and Satvika Gopalasetti, plan to invest $5,000 into Reaspire, amounting to a total of $15,000. $300 of these dollars will be used to file for a 501c3 nonprofit status. Reaspire will need to raise about $30,000 per year. Reaspire will apply for grants from the government as well as appeal to company philanthropy to raise a large portion of its funds. In addition, Reaspire will host both paid and unpaid educational seminars during which it will pitch its app and request donations. If needed, Reaspire will rely on in-app advertising as another source of funds.
In the future, to market our app, Reaspire will contact and establish partnerships with hospitals, doctors, and other COPD healthcare professionals who have already established direct contact with COPD patients. Additionally, we will host a panel of COPD patients to provide insights on their daily efforts and to manage the symptoms and the problems they typically face, as well as healthcare professionals to provide reputable suggestions on how COPD patients should structure their treatment plan. Although the focus of the seminar will be educational in order to attract COPD patients and boost Reaspire's brand image as a social enterprise, Reaspire will take this opportunity to promote its app to the audience and request donations.
Thank you for listening.